One of them is nutrition, obviously. Nutrition is huge. Just size and shape of the bone itself determined genetically, but can be modified and influenced by nutrition and hormones. In terms of nutrition, calcium, protein is a big one as well, right? And other nutrients during growth and development can cause bones to be small. It can cause people to be much shorter than they should be. I don't know if I told you guys, when I was younger, much younger, I did a lot of medical missionary trips. One of the places we went was, in Africa. We went to Burkina Faso, we went to Mali for like 3 months. And what happened was you would see people that were 16, 17 years old. And because of their height, they looked like 12 and 13, right? Why were they that short? Is because of the lack of protein and calcium. Keep in mind, you can get enough calories to survive and even get kind of chunky, right? You need protein though to grow in length, right? To get taller. You need protein to form albumin so then you don't have edema. Protein is incredibly important, right? One of the things protein allows us to do is to form that collagen. Calcium allows us to have calcium phosphate to make the bones more dense. Now, vitamin D is a decavitamin that requires fats to be absorbed. So I always see nowadays, if you look at milk, even skim milk is fortified with vitamin D. The problem with skim milk with vitamin D is that there's not enough fat in skim milk to actually absorb the vitamin D. So the only thing that should actually be fortified with vitamin D is whole milk. The problem with whole milk is, if you're used to skim milk, whole milk is like really thick. It's like creamer, right? Now most people don't even drink milk anymore. They drink like, almond milk, soy milk, things like that. But with those, again, almond milk and soy milk, they don't have enough fats for it to be fortified with vitamin D. You get the calcium, but not the vitamin D. Now, vitamin D, always found in, right, a capsule form, and inside of the capsule, there's a little bit of oil. That oil allows you to absorb that vitamin D. That's true of vitamin E and A, right? They're always found as capsules, not tablets. Vitamin D allows us to absorb calcium, and you need to supplement calcium. When you're taking vitamin D, obviously one of the ways we form vitamin D is through a series of reactions that starts with getting ultraviolet radiation, sunlight, right? But even if there's sunlight and it's 30 degrees out, you're not going to be laying out shirtless, all right? Or just in your, short sleeves. In other words, even if there's sunlight and it's that cold, the only thing that's actually receiving the sunlight would be our face. That's it, right? Not enough light in our, kind of touching our face to stimulate enough vitamin D formation. So in the winter months, we should take a lot more vitamin D. Now for women, it's even more important, right, to have that vitamin D. But when you're taking vitamin D, you also need to take calcium with it, right? You need both. And that's like the hidden sign. Doctors prescribe vitamin D, but don't remind the patients to take calcium, right? Vitamin D is required, but so is calcium. Can be eaten or manufactured in the body. If you don't have vitamin D during childhood, you have rickets. What does rickets look like? I'm just going to move a little bit further here. Right? These are a sign of rickets. People who have severely bowed legs, severely bowed arms. Right? Now, we usually see the bowed legs and the arms, especially with the legs, when they start to crawl. Right? Because of the lack of vitamin D, you're not going to absorb as much calcium. The bones aren't going to be as rigid. So when you start having a baby that's able to crawl, they put their body weight on their arms. At that point, then the bones are not strong enough for their body weight, and the bones start to curve. Same thing with the legs. As the baby starts to learn how to walk, the leg bones, the femur and the tibia, right, cannot support their body weight, and they start to curve, and then we get the bow-leggedness that we see in rickets. Now, not all people who are bow-legged has rickets, and you've probably seen people who are, that's bow-legged that can run super fast even, right? Now, usually we see other signs. This baby soft spot, the anterior fontanelle closes much, much later. Instead of the first year, first 6 months in some people, it closes in the second or third years, right? And that's a sign that you don't have as much ossification as you should. Now the bow-legged, bow-armed, that is telltale sign of rickets, both of them. What else do we need? Vitamin C. Vitamin C is necessary to produce collagen, right? Scurvy is a deficiency of vitamin C. And you would think, scurvy, right? Who's even heard of scurvy nowadays? All right, we got rid of it. Why? Because it's easy. All you do is take vitamin C. But we are starting to see more people with scurvy because of the diets that people are on. The paleo diet, the Atkins diet, especially the high protein, high fat diets. They're supposed to avoid a lot of the sugars that are found in some of the fruits, right? So if you're trying to avoid the sugars, you're not going to drink orange juice. That's a lot of sugar. What happens? Well, vitamin C is also found a lot in oranges and limes, right? So we are starting to see a comeback in scurvy. And scurvy is a pretty ugly thing that can cause people to actually die, right? Here's scurvy, and it's kind of crazy that usually, in terms of images, you see teeth, right? All the joints start to become weakened. The teeth are a joint between your teeth and your mandible, or your teeth and your maxilla. As that process, that joint starts to weaken, people have bleeding gums. They will start losing their teeth as well, right? And these are all signs of scurvy. You have incomplete healing, pale skin, right? And, right, overall degeneration of the soft tissue. So that's not a good thing. Yeah, I don't know why they always have this picture of this guy. And they always show the teeth, but you can also get lots of ulcers that develop because the collagen in the skin is no longer intact. The dermis thins out. As the dermis thins out, it's more likely that any cut will go into the dermis where your blood vessels are, and then becomes an infection in that area. So again, it's one of those rare things where we thought we got over this, right? Kind of like chicken pox, and even measles and mumps. We shouldn't see those anymore. But we're starting to see some of these diseases come back. What other factors? Hormones. Growth hormone from the anterior pituitary gland stimulates both interstitial and appositional bone growth. Again, right? When you have yet to hit full adult height, then you will grow in height when you're given growth hormone. If you've already attained your full adult height, somebody gives you growth hormone, you're going to grow in width, and the bones are going to get thicker and stronger as a result of it. Sex hormones such as estrogen and testosterone also play a big role in our bone growth. There's a reason why females grow earlier and stop growing earlier as well, right? Why? It's because estrogen is a more potent stimulator, but causes premature closure of the growth plates in both males and females. And keep in mind, right? Females have a lot of estrogen, but you get some testosterone as well. There's always going to be minimal levels of testosterone. For males, right, we have a lot of testosterone, but we'll also have some estrogen. The more testosterone we have, the more some of it gets converted to estrogen. So you hear people taking anabolic steroids and they start developing breasts. Why? It's because the higher the testosterone levels, the more likely that more of the excess testosterone gets turned into estrogen. All right, so this is a pituitary giant. And with pituitary giants, they keep growing for the rest of their life, right? And the bad thing about it is we can do whatever we can to, hopefully, and I know they've, done surgeries to try to remove part of the pituitary that's cancerous in the hopes of decreasing the amount of HGH, and usually it just grows right back, right? And they keep growing and growing. Now, usually people that are pituitary giants, they don't have a normal lifespan. They die at a much early age because of the cardiovascular issues they have. Now, this is a pituitary dwarf, right? When you have a pituitary dwarfism, compare that with an achondroplasic dwarf, right here. Achondroplasic dwarf only has an issue with their long bones. So if you look at the torso region, should be very similar between these two twin boys. The big difference is the long bones, right? So the long bones of achondroplasic dwarfs are the area that is affected, right? Skull, very similar size. Even the one with achondroplasia is a little bit larger, right? So for achondroplasia, it's the long bones. For pituitary dwarfs, it's everything, right? Even the organs are severely shrunken and smaller. Even the brain is smaller than compared to a person of the same age. Right? The weird thing is this, you think the brain size is smaller, they're not going to be as smart, right? They usually have the same IQ. So it's not the brain size, right, that is quite as important. So we know that they usually do have the same capacity to learn as a normal sized child. Now, when we look at bone remodeling, right here, all right, keep in mind, this is occurring continuously, right? We're always remodeling bone, even as we're sitting here today. What we're gonna do is, we're gonna convert that newly made bone, this newly made woven bone, into the much stronger lamellar bones, caused by migration of basic multicellular units, meaning that a group of osteoclasts goes to the site where you need the bone remodeling. The osteoclast kind of destroys that area, and then osteoblast starts to make new bone material there. Bone remodeling is involved in bone growth, changes in shape of the bones, and adjustment in bone due to stress, and of course bone repair, right? And calcium ion regulation. But stress becomes a big factor in terms of bone remodeling. So much so that if you ever go to the gym, most of the people you see at the gym now are usually elderly people working out, all right? The reason why is simple. As they work out in the gym, they're trying to increase that stress on the bones so you can build more bone, right? The more stress we put on an area, the more bone building we will have in that area. The opposite's also true. The less stress you put on the bone, the less remodeling and adjustment we make. We'll talk about examples in just a few minutes, right? Relative thickness of the bone changes as the bone grows because bone is constantly removed by osteoclasts and newborn is constantly being formed by osteoblasts. Right, formation of new osteons and compact bone. Osteoclast enters the osteon from the bloodstream and moves the lamella and removes the lamella. Then osteoblast enters and starts forming new bone matter. Right. How about this stress? Stress causes bone remodeling. We can see it in a couple instances. One instance is with braces, right? Anybody's ever had braces here, right? If you've had braces, when they tighten it, it hurts. It puts stress on your jaw, puts stress on your teeth, right? As you put stress on that area, the area where you put stress, you have increased bone remodeling. The area where you have less stress, you're gonna have increased bone destruction in that area. That allows you to move the bone, move the teeth, right? And its connection to the bone. So in terms of stress, stress plays a big role in the formation of bone. and where it's formed, right? Gravity, weight-bearing exercise allows us to have increased bone deposition. That's why people always say, like, for your joints, swimming is really good. Really good cardiovascular workout, really good for the joints, because you're not pounding your weight onto pavement like you are if you're running. The bad news about swimming is, do you put any kind of stress on any of the bones? No. If all you do is swim, you're not going to have as much bone deposition as you should. That's why you should have a kind of a mix, right, of weight-bearing exercise like weightlifting, and right, if you want, swimming. Now, we also see this with people who are astronauts. People who are astronauts, right, if they're in space, there's no gravity. If there's no gravity, you have no weight, right? So you don't weigh anything, right? You're floating around. There's no weight. What happens to your bone? Well, you're going to, right, destroy more bone than you're going to build, right? It is not unheard of people that are astronauts, and they've been in the International Space Station for a year and a half. For them to come down from the International Space Station after the year and a half, and have lost their bone density by 40%, right? You always, now let me ask you, how many times have you seen pictures of astronauts going into the, right, either the space shuttle, when we have one, or into the rockets, right? Probably you've seen a lot of pictures of astronauts going into the shuttle, into the actual, rockets, right? How many times have you seen pictures of astronauts leaving and exiting, right? And you would think, right away, let's do an interview with them so that we can see how they feel, right? No. Usually when they exit and they come back from their trip to space, and it's been like many, many months or a year, well, their bone density is so low that if they were to fall, they would fracture their leg, right? And what happens? Usually you don't see pictures, because as they're leaving, they're usually on a wheelchair, being wheeled out, right? One of the other problems is this. They're so accustomed to that now zero gravity environment, the heart doesn't have to work as hard. So now they come down, and all that gravity pulls down on them again. Makes it harder for blood to even move, right? So that does happen. And some of these older astronauts talk about how debilitating it gets. It takes them months and months to recover from. One of the things they have a hard time with is, right, this bone loss. Right? I'm not going to ask about bone repair and the type of fractures. The last thing we kind of mention are just the calcium homeostasis and some of the diseases, and then we'll be done. So we'll keep going, probably another 15, 20 minutes. Get out a little early. If you've taken the test, stay here. If you guys haven't, you guys, all right, you make sure you tell me your name, and then I'll put it in the testing center. Calcium homeostasis. Right? Again, the body is worried not about the blood, about the bone calcium concentration. It's worried about the level of calcium in the blood. Right? You guys know that without calcium, your blood doesn't even clot. Right? So if you guys have ever gotten a blood draw before, if you've gotten a blood draw somewhere in a clinic, if you look at the test tube, the very end of the test tube usually has some kind of like plastic film, something in there. It's not empty. There's something at the bottom of the test tube, right? That area at the bottom of the test tube, all it does, that chemical there, all it does is remove calcium. By removing calcium from your blood, the blood stays liquid, right? It doesn't clot. If we didn't have that little bit of material in the bottom of the test tube, whenever we remove blood, it will just clot within minutes, right? And you can't do any lab tests on blood that's clotted. So there's no point of even going down there. So by removing calcium, we can't form clots, right? Now calcium is also required for your muscles to contract, for your neurons to fire. So it's incredibly important. And where does the skeletal muscles, the cardiac muscles, the smooth muscles and the neurons get that calcium from? It gets it from our bloodstream. So we are always worried only about blood calcium levels, right? Blood enters bone when osteoblast creates new bone, right? Calcium leaves the bone when osteoclast breaks down the bone. Makes sense. You break down the bone, now you have free calcium, some of it goes into the bloodstream. There are two hormones that control blood calcium levels, parathyroid hormone and calcitonin. They work in opposition. PTH, or parathyroid hormone, is found right next to your thyroid gland. They're released when there is decreased blood calcium levels. Again, nothing to do with bone. When your blood calcium levels go down, parathyroid hormone releases parathyroid gland. That parathyroid gland releases parathyroid hormone. Sorry about that. Right? The hormone does a couple things. One, stimulates your osteoclast, your bone breakers here. Right? The osteoclast then releases calcium into the bloodstream. At the same time, parathyroid hormone also inhibits the loss of calcium from urination. So then we reabsorb as much as possible, right? And PTH stimulates the production of vitamin D. That with the help of ultraviolet radiation, it goes to the liver, right? And vitamin D allows us to increase efficiency of absorbing dietary calcium, right? All so that we can increase blood calcium levels. That's a big thing. As your blood calcium levels increase, what happens? Negative feedback. You have less PTH being released, right? So we want high levels of calcium here. Now, keep in mind, we always lose a little bit of calcium from the urinary system. No matter how great we try to reabsorb it all, we always urinate a little bit of calcium out. So if you don't get enough calcium a day, you'll have more PTH being released, more bone destruction, so then we can normalize your calcium levels. But then, throughout the course of the day, you urinate some of it out again. So if you don't get enough the next day, the same cycle continues, right? More PTH, more bone destruction, more blood calcium levels right here, right? Then you urinate it out. So what happens is becomes a bad loop that we're stuck in, where we destroy more bone matter. Eventually, that will lead to osteoporosis. Now, what happens when we have increased amount of blood calcium? When we have too much blood calcium, obviously, the parathyroid glands shut down. As they shut down, we activate a second group of cells found in the thyroid itself. These are calcitonin releasing cells here. Calcitonin does the opposite of PTH, right? So you have increased amount of blood calcium. We're going to inhibit the bone destroyers and activate the bone builders, right? Kind of makes sense. You have a lot of calcium. Now it's a time to store that calcium. And we're going to make new bones at that point, right? Promotes the production of bone. Perfect. So then, if for some reason you don't get enough in the diet the next day, you'll have at least enough bone so that we can have calcium to be released, right? Now, what happens as we age, bone matrix decreases, the bones become more brittle due to lack of collagen, but also because of the lack of the lesser amount of hydroxyapatite, right? Bones become not as strong and increase flexibility. Now the big thing is, right, as we age, little falls that we think should be embarrassing becomes life-threatening. Instead of, kind of laughing about it, you might be going to the emergency room because you fractured a leg, right? Just from the same fall. Bone mass decreases, highest around age of 30. Men has denser mass due to testosterone and weight, right? African Americans, Hispanics have higher bone masses when compared to Caucasians and Asians. Some of that can be attributed to genetics. Some of that can be attributed to diet as well, right? Rate of bone loss. This is the big one for all females. The rate of bone loss increases tenfold. In other words, 1,000% increase after menopause. Right? So after menopause, you no longer have estrogen to protect. And at that point, your bone loss from a bad diet accelerates tremendously. Now, all of this leads to osteoporosis and increased probability of bone fractures, right? So little things like, you guys probably fall down, have your hands in front of you, right? Might sprain a wrist. When you get older, you might break a radius, right? That happens. Again, I'm not going to discuss bone fractures, so you guys can skip that. Now, what is osteoporosis? Osteoporosis, pathology, right? Where we are basically going to not get enough calcium in our diet. And again, for males, we always have testosterone to kind of protect us. Yeah, it goes down a little bit with age, but nowhere near what happens to females with estrogen levels after menopause. All right, at menopause, you have estrogen that are very protective of the heart, very protective of the bone, right? A lot of different protections from estrogen. But as the levels fall off a cliff after menopause, you no longer have that protection from estrogen, right? Women, right, have increased risk of cardiovascular disease after menopause. Now, it never increases to the same level as a man, but they increase tremendously after menopause. That's one of the reasons why when females 20, 30 years ago hit menopause, they were almost always on hormone replacement therapy, right? So estrogen is a protection. When you hit menopause back then, I mean, this isn't that long ago, late 1990s, we were giving women hormone replacement therapy. Nowadays, you hit menopause, they do not give you the therapy anymore. Why? Right? The reason why is simple, right? We give people lots of estrogen back then, and it was in the hopes that it would decrease your stroke, decrease your myocardial infarct risk, right? Because we know once you hit menopause, those risks skyrocket. So if I give you, estrogen after menopause, it should be protective, right? It wasn't. It actually increased the risk even more. Not only that, they did this huge study, and it showed that it increased the risk of breast and uterine cancers. So almost immediately, people that were on hormone replacement therapy were kind of, shunted and moved out of it, right? And the problem that we saw was people were complaining of hot flashes and loss of bone density, right? Now there are other medications that increase the bone density, but diet is probably the easiest way to go through it. And again, right, your body is only worried about the blood calcium. It's not worried about your bone. It's up to you to get enough calcium. So who's at most risk of osteoporosis? Right? White, Asian, thin, postmenopausal women. Now, if you smoke, you drink, then, and have family history, you're at even greater risk of osteoporosis. Now, with osteoporosis, then you can have, kyphosis and lordosis, where you're going to have the vertebrae start to become more forward. The weird one is this: athletes. Athletes who are not menstruating due to low body fat have decreased estrogen levels. And because of that, they're also at risk for osteoporosis, right? So if you see these women's soccer players, they're amazing, right? WNBA basketball players, they can never, usually when they're in season, they're exercising so much that their body fat is so low, they don't produce enough estrogens, right? The estrogens then, right, when it's that low, they don't have normal cycles anymore. They don't menstruate. And if you don't menstruate, you don't ovulate. If you don't ovulate, you don't get pregnant, right? In some ways that's good, in some ways it's bad, because if you're not, ovulating, you're not gonna get pregnant, you're not gonna have a baby you want, right? So usually you'll see females, right, retire for a year or two. So then they don't, have to exercise to the same extent. Their menstrual cycle starts to normalize. they start ovulating, then they get a chance to get pregnant. We see it all the time with, Olympic athletes, right? They always retire, females always retire after Olympic, right? And then after a couple years, they've had a couple babies, then they get back in shape for the next one. Vegans as well, right? People who have eating disorders also have issues with osteoporosis. We talked about rickets. The last thing we'll talk about is this, achondroplasia. Achondroplasia is dwarfism. Long bones are affected. The flat bones of cranium and face are, in terms of size, normal size, but usually a little bit thicker, right? And because of that, they have a problem with water in the brain, hydrocephalus. Now, all of us have CSF in the brain, right? It allows you to float the brain, protect the brain from the skull itself, right? It allows you to kind of enrich the actual brain material, bathe it in a high sodium, high potassium kind of bath. Perfect, right? Now, for people that have achondroplasia, they have a hard time recycling the cerebrospinal fluid, the CSF. As they have a harder time recycling it, there'll be a buildup of it. That's hydrocephalus, a buildup beyond normal concentrations, right? Normally then they would need a little shunt, a little plastic tubing that's connected to the skull that takes that excess fluid and introduce it right into the subclavian veins. Now with achondroplasia, it is autosomal dominant inheritance. Now, autosomal dominance means that all it takes is one bad gene. If you have one bad gene from any parent, you're going to have the disease. It's not like we see in sickle cell, where if you have one bad gene, one good gene, you have the trait. You don't have the full-blown disease, right? Here, all it takes is one bad gene, and then you have the full-blown disease. If you have two bad genes, inherited from one from each parent, what happens? You have the lethal version of this disease. All right, the lethal version of the disease, you don't survive birth, right? Usually, those kids are going to be miscarried, right? Or die right after birth. So it is very traumatic, and when you have two achondroplasic dwarfs that get in a relationship and they're about to get married, usually they undergo tremendous amount of genetic counseling, right? They don't just kind of wing it and just hope for the best, because the risk factor of having a child with the homozygous form, where they have two of the bad genes, is so great, right, that they don't want to risk that. Now, what do I mean by homozygous, heterozygous? You guys have probably seen these Punnett squares before, right? With the Punnett squares, and again,